Hi, I'm Haley. The topic that I'd like to speak to you guys about today is the topic of cancer screening without radiation. I'd like to talk about maybe some of the current problems that brings me to this particular topic. Ionic radiation is the most common mutating substance known to man. It also happens to be more commonly known as X-rays. X-rays over time will accumulate more radiation, and the radiation will create more mutations, and the mutations create cancer. To be considered cancerous, it does have to be between 1 and 10 mutations. However, a lot of the articles that I've read, they usually say about 4 mutations is where they will start to call it cancer. I'd like to present a couple ideas of alternative means to radiation. Some of these ideas is thermal and regulatory imaging. The first one I'll talk about today is thermal imaging, also known as thermography. This was actually done by the military. It was invented by the military for the means of being able to spy on the enemy with thermal devices so that they could see inside buildings, behind walls, even underground. Today, we actually use it, the military still uses it, but we also use it for bridges and houses to be able to test their stability, the way that the heat and the cold affect it. This technology was actually the founding idea for thermal detection of irregularities in the body. However, the human body happens to be a little more complex than just drywall or brick. We have overlapping heat signatures, so that we can have a cold tissue in front of a hot tissue, and we won't see the hot tissue behind it, which is why I actually bring us to our secondary type of imaging. Regulatory imaging. Regulatory thermal imaging, it takes a preliminary reading of about 60 points of your body, and then it's exposed to a rapid heating and cooling, which exposes the more violently affected areas to basically glow red, because they don't change, they don't get cold. When your temperature responds in such a way where it is kind of a violently red, it will also expose a couple of other processes, such as heavy metal accumulation, bacterial infection, tumor growth, etc. These occur metabolically. Another thing that I'd like to point out is that there's kind of a saying, it's called, if it's cold, it's old. With that interpreted, it's that when your tissues are showing a cold reading, it's not something that is currently in use, it's not something that is currently needing attention, such as like when you are digesting in your stomach, it will show a heat signature because you're digesting, it's actively being used, there's a lot of energy going there. When something isn't actively being used, such as like our regular tissues aren't always in use, they will show hot when they're being used in a violently infected area. There's rapid growth, of there's something's going on. With this form of, with the regulatory thermal imaging, we're more accurately able to see those things, which is why dental applications is actually another option. Say you get your dental, most of us, every 6 months, which means we're being exposed to the ionic radiation in the same spot on our mouth every 6 months. This can be problematic because of the ionic radiation. When it overlaps on top of itself like that, it can create any inflamed areas in your mouth to get worse. They can mutate. Some of the things that we can use the thermal identification for, as far as dentistry, is seeing the leaching into the bones or surrounding tissues. We could see bacterial infections. Those inflamed spots will glow. In medicine, we say catching something early has better prognosis. Waiting until a tumor on your body can be felt isn't early. That's actually very late. But when you can catch a misfire, a regulatory misfire or overfire in our body, it's early. You're able to see the hot spots before they become a problem. My conclusion today is that thermometry actually is another form of regulatory imaging. We didn't speak about it earlier because it's an accumulation of those two imagings. It's actually in practice today, and it boasts about a 93% accuracy, whereas mammograms that use radiation and other types of radiology, it boasts a 70% accuracy in detecting tumors. My proposition today is that we decrease the use of ionic radiation in our lives and increase regulatory thermal imaging. Perhaps this will decrease the amount of cancer patients we see. I'm not saying that we should get